Now today what I wanted to talk to you about was sciatica. What it is, why a lot of women in pregnancy suffer from it, and what you can do about it. I've just released on my YouTube channel a very quick 2.5 minutes exercise that you can do to really help relieve that symptom. So we'll start from the beginning, and feel free to type in any questions that you have. I don't know if anyone out there has experienced or is experiencing at the moment pain in one side of their buttocks, or maybe two. Most often it's just on one side, and it's a real burning, searing kind of pain that you get through generally one side of your buttock that goes right down the middle of the back of your leg, sometimes all the way down to the foot. And this is generally termed sciatic pain. What it is, it's your sciatic nerve, or the roots to the sciatic nerve, that are pinched or compressed somewhere along the line. Now your sciatic nerve it's one of the biggest nerves you have in your body, and it goes all the way down that line that I just described, and it originates from 5 nerve roots that come out from your lower back and sacrum, from L4 all the way to S3, and all those nerve roots exit out, create this one big nerve, and it goes all the way down. So that means that there are different exit point areas where it comes out from your spine, where these nerves can start getting compressed or irritated. And also, as it goes past the buttocks down into the leg, all these layers of muscles cover that nerve and can become tight and compress it, causing irritation, and you get this radiating pain sensation, and that's what causes it. Now, a lot of women suffer from this during pregnancy, especially during the later stages, and you can see why now that you understand where that nerve comes from. When you're pregnant, the heavier you get, the bigger your bump is. So let's have a look down like this. So the bigger your bump gets, the more your weight bearing through the front. So your center of gravity really tips forward. What happens is that your bump pulls you forwards, and your pelvis starts to tip forwards. Sorry, I had a notification come up. So when you're pregnant, you have all this extra weight in front from bump, from baby, and it starts to tilt forwards. Your pelvis then starts to tip forwards like that. And what happens in your lumbar spine is compression. So you got your vertebrae that start compressing that way, which is exactly where the nerve roots come out from. So you have an area there that's compressed, that's irritating the nerve. Then, as those nerve roots combine and pass through the buttocks, they have to go under all your gluteal muscles, but also under your piriformis muscle, which is the muscle that specifically compresses the nerve most of the time. Can you imagine when your pelvis is tilted this way, all these muscles here are actually shortened. That makes them tighter over time, and if they're not stretched out properly and loose, they don't allow that nerve to pass through without compressing it a little bit and creating those problems. So there are lots of little things that you can do to prevent this from happening in the first place. Definitely say once you start gaining extra weight and the bump grows, avoid wearing heels often. Of course, you can still manage that, but avoid wearing heels all the time, so that your posture isn't hitched even further into lordosis, where you get this excessive curve in the lower back that compresses the spine and shortens those gluteal muscles. So avoiding the heels, and also making sure that you do enough exercises to maintain a good posture, so a good correct posture, and I can't recommend anything better than pregnancy yoga and Pilates for that. And then very specific exercises, physiotherapy exercises, many of which are also derived from yoga, stretching. The deep breathing and the meditation that goes with all of that is fantastic for releasing body tension, gluteal tension, and for aligning your spine correctly. As your curves change and your weight balance, your weight distribution changes, you really need to think about how you're holding yourself to allow those nerve roots to exit without compression, to keep those muscles and the glutes nice and lengthened. So if you haven't watched it already, then hop on over to the link that I'll put in the comments box, and that's the latest video that I've put out in my my new pregnancy Pilates yoga series. And it shows you how to do the stretch for the gluteal muscle release correctly, because a lot of the time you can search for a sciatic exercise release technique, and a lot of these are aimed at sports people or people who aren't pregnant, and a lot of them involve you having to lie on your back, lie on the floor, get into quite difficult positions. If you're not used to yoga, if you're not used to going into pigeon position and things like that, you might find it really quite challenging, especially later on in pregnancy, in the 3rd trimester, where everything is really quite hard to deal with anyway. So this one, in this exercise, you're sitting on a very firm seat, got a nice wide base of support. It's very easy to get into this position when you're pregnant. And there are 3 stages to it. You see, a lot of the exercises just explain for you to go for that full stretch straight away. But in pregnancy, I find it much safer and much more effective to break it down into 3 different steps. So there's a first level, and if your sciatica is quite intense, you haven't done anything about it already, you might find that being in that initial position is all you need to do to start feeling some release. And I must warn you, it might feel quite tense at the beginning. It's very important to release the shoulders, breathe in deeply, and as you breathe out, really visualize the gluteal muscles relaxing and laying off that pressure from your sciatic nerve. There are 2 further levels that you can add to that stretch. And I must say, there's no need to go into them if you're finding the first position effective already. And it's about repeating this exercise every hour on the hour. It's little and often, holding it for 30 seconds to a minute at a time, and really relaxing, focusing on the release and not focusing on the pain, because whatever you put into your exercise, the focus and visualizations that you use, the more effective that exercise is going to be. So if anyone has any questions, then please leave it in the comments box and I'll get back to you. I'll do, maybe if there are a lot of questions, I'll do another live stream and try and answer all of them. And if not, definitely hop over onto the YouTube channel and you can look for the playlist for pregnancy yoga Pilates. And there are going to be loads more videos in my series. I've already done one for swollen ankles and feet, one for lower back pain release. That is definitely one. If you have sciatica, you want to combine it with that exercise as well. And you'll probably have swollen, tired legs, so do the 3rd exercise as well. The more you can do, little and often, that's why my exercises are all in 3-minute bursts, so that you can fit them in around your busy lifestyle. You can do it at the office, on a coffee break. It doesn't require a mat or any equipment. You can just do them at your desk or in standing in a corner somewhere discreetly. And you'll get a lot of benefit from them. Even if you don't have symptoms at the moment, I would strongly recommend you do them anyway to prevent these typical types of problems from occurring. And just to keep fit and healthy anyway, your pregnancy is a marathon and your shape, your curves are changing every day with more demands on your joints, more demands on your muscles, and you need to keep toning gently. You need to maintain good posture. You need to maintain enough length through the spine, opening up the chest, because as baby bump grows upwards, it's compressing your chest as well. You're getting short of breath when you're climbing upstairs, something that was so simple for you before, maybe just 5 steps, and I remember being completely panting at the top, thinking, what's wrong with me? I feel like I've run a marathon. And it's that extra exertion, but it's also the fact that your lungs are really compressed, so you're not taking in that much air, you're not oxygenating everything as much as you can. And that, when you think about the whole cycle of things, not oxygenating enough, then that leads to more fatigue, and that's what a lot of women experience during pregnancy. It's just feeling super tired, really drained all the time. So it's this cycle that could be a vicious cycle of pain, discomfort, shortness of breath, the fatigue, but you can change it around so easily with these easy maintenance exercises and being mindful about your posture. So that's my message to you. It's even if you don't have any discomforts or pain anymore or anything like that, then, oh, hello, Anna. Then please do them anyway to prevent problems from occurring. So if you've enjoyed this, you want to see more, please leave a comment in the box and let me know what problems you're suffering with, what kind of help you'd like to get. Ask me any physiotherapy and Pilates questions about posture, about what exercises you could be doing. I'd love to know so that it guides me in what we do in our future sessions. So there you go. Follow me here and subscribe to my YouTube channel. I'll see you soon for loads more tips on how to best enjoy your pregnancy and prepare for a fantastic birth. I'll see you soon.